Medigap Plan N can be a great value. Its premiums are often 30% less than Plan F and 20% less than Plan G. And that means if you're new to Medicare, you might be able to find a Plan N for under $100 a month, depending on what state you're in. So you might be wondering, well, what's the catch then with Plan N? Well, there's no trickery or a super fine print involved. However, there are some things you need to know about Plan N and what benefits it doesn't cover. So stick with me and I'll tell you what they are. Hi, I'm Joanne Quinn and thanks for joining me today. I'm co-founder of REMEDIGAP.com, where I've written over 50 articles about Medicare and Medigap insurance. And when we're talking about Medicare insurance, Medicare supplements specifically, we often think of Medigap Plan F, and that's because it's been the most popular one for years and it covers all your coinsurance, copays, and deductibles. When we think about value plans with Medigap, Plan G comes to mind, but Plan N should not be overlooked. Its low premiums make it stand out. You just need to know what benefits it does not have when compared to Plan F and Plan G. Taking a look at Plan F, G, and N side by side, Plan F of course covers every benefit on the chart, whereas Plan G and Plan N don't cover the Part B deductible. That's what these two plans have in common. Now let's focus on the differences of Plan N because this is where it really starts to separate itself from Plan G. With Plan N, you have copays to the provider and to the emergency room. Let's start with the provider. When you visit the provider, you will have a copay anywhere from $0 to $20. So that means the provider, at their discretion, can charge you a $0 copay, anything in between, but never more than $20 to visit that provider. And so rest assured that when you go to the doctor, your copay would never be more than $20, and it could be as little as $0. The emergency room copay, that is a $50 copay. However, if you're admitted into the hospital, that copay is waived, but you do need to make sure that you are admitted under a Part A expense. Okay, that was the easy part. Now we're moving on to Medicare Part B excess charges. Now, excess charges are covered under Plan F and Plan G, but they are not a covered benefit under Plan N. But the good news is that if you visit a doctor who accepts Medicare assignment, Plan B excess charges would not apply to you under Plan N. And this is important, and this is what we're going to discuss right now is Part B excess charges and Medicare assignment and how they go together and how it can affect you on Plan N. All right, a doctor can accept Medicare patients but not accept Medicare assignment. I'm going to repeat that again. A doctor can see Medicare patients but not accept Medicare assignment. This is really important, and under Plan N, something we need to pay attention to. When a doctor doesn't accept Medicare assignment, basically what they're telling Medicare is, we'll see these Medicare patients, but we don't agree with how much you're paying us. And by you, they're talking to Medicare. They don't agree with the Medicare approved amount. So when they tell Medicare they don't accept assignment, what they're saying is, we don't accept how much Medicare is paying us, so now we're allowed to charge the patient 15% of the approved amount from Medicare. So for example, if you went to the doctor and the doctor sent your claim to Medicare and charged Medicare $250 for the service they provided to you, Medicare may only approve $100 of that. If the doctor does not accept Medicare assignment, then they are allowed to charge you 15% of that $100, which means you would get a bill for $15. And that's not a huge excess charge, but it is an excess charge and an example of how it could add up over time. Now, it's easy to find out if doctors accept Medicare assignment or not, and I'm going to show you how. Here we are at Medicare.gov, where we're going to locate doctors and whether or not they accept Medicare assignment. I'm going to show you how easy this is. All you need to do is go to Find Doctors and Other Health Professionals. And here you can put in your zip code, city, state, and address. And then over here you can put in your doctor's last name or specialty, or they ask for a medical condition. So they give you a variety of choices in order to search for a doctor. I'm going to put in a zip code of 29576, and I don't know, let's say there's a Dr. Smith. And here's some Smiths. Okay, so we'll select this Smith and we'll do a search. And it'll populate and it's going to tell me a little bit of information about this doctor. But what I'm looking for is whether or not this doctor accepts Medicare assignment. And at the very bottom, it will tell me this doctor accepts Medicare assignment. And here it's saying the healthcare professional accepts the Medicare approved amount. You will not be billed for any more than the Medicare deductible and coinsurance. So basically what that means, like we said before, Medigap Plan N, you pay that Part B deductible, and then coinsurance, which if you have Plan N, you're not going to pay for coinsurance, it's going to be covered. So what they're telling you here is that you won't have to worry about Part B excess charges. The only thing you have to worry about is the deductible, which you already know you have to pay, and any coinsurance. And that applies to people who don't have a Medigap plan, but who only have Medicare Part A and B. They have to pay that 20% coinsurance. They don't have anything helping them out. Okay, let's do a new search. And we're going to do it by specialty this time. Let's say dermatologist. Dermatology. Here we go. Let's see what doctors are in this area that do dermatology and whether or not they accept assignment. So here they're giving us a list within this area of doctors. And if you take a look here, see this little, I guess it looks to me like a little clipboard. I'm sure it's very tiny on your screen. But the point is this little clipboard shows you that the doctor accepts Medicare assignment. This is the symbol for accepting assignment. And as you can see, every single one of these doctors that's popping up actually accepts assignment. It may be hard to find anyone who doesn't. Because like I said before, not very many doctors don't. But aha, we found one. Here we did find a doctor that doesn't accept Medicare assignment. And you can tell because it has a little question mark. I'm going to open him up. And let's take a peek. So here's a little information about this doctor. But what it says at the bottom, which we're most interested with right now, is that may accept a Medicare assignment. So it's questionable. So you are taking a chance that you may be billed Part B excess charges if you see this physician. It says the healthcare professional may accept the Medicare approved amount. You may be billed for more than the Medicare deductible and coinsurance. So what that means is you may be billed for Part B excess charges. Okay, I'm going to go back to the physician compare home so you can see where it is if you need to go back. You also have this little tab if you just want to go back to your original results. We can do that. And it'll take you back to your list of doctors. And then if you want to go back to the physician compare home, you can do that as well. Before we do that, I want to show you the side over here, the sidebar. You can ask Medicare to only show you those who accept Medicare approved amount. And we're going to update the results. And now that doctor is gone. So you can refine your search the way you want over on the sidebar. That was a pretty handy tool. Now you see how easy that was to find out if a doctor accepts Medicare assignment, and clearly many do. Now you can also call a doctor's office and ask them if they accept Medicare assignment, but I struggle with that because sometimes you just don't know who's working at the office, who's picking up that phone, and who you're talking to. It could be someone who's brand new or someone who really doesn't understand what Medicare assignment really means. So that's why I like using Medicare.gov's tool to find out if a doctor actually does accept Medicare assignment. As a side note, there are some states that do not allow excess charges. That would be a Medicare overcharge measure law. Those states are Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont. And if you use Plan N in any of those states, you would not be charged a Part B excess charge. Okay, time for a quick quiz, and this is going to be fun, and no one's keeping track except you. So let's see how well you do. All right, question number 1. Medigap Plan N and Medigap Plan G don't cover which benefit? A, Medicare Part A deductible, B, Medicare Part B deductible, C, Medicare Part B coinsurance, or D, none of the above. Now you can pause the video if you need to think about it. Okay, here's the answer. If you said B, the Part B deductible, then you're correct. That's the one benefit Plan G and Plan N don't cover. Question number 2. Medigap Plan N provider copays are usually more than $20 a visit. A, true, or B, false? Okay, here's the answer. If you said B, false, you're correct. The provider copays are never more than $20. And remember, they can be as little as $0, but never more than 20. Question number 3. You pay Medicare Part B excess charges if A, you have Plan N and you visit a doctor who accepts Medicare assignment. B, you have Medigap Plan G and visit a doctor who doesn't accept Medicare assignment. C, you have Plan N and visit a provider that doesn't accept Medicare assignment. D, none of the above. The answer is C. Plan N does not cover Part B excess charges, and they're only applied if the provider doesn't accept Medicare assignment. Last question, number 4. The best way to find out if a doctor accepts Medicare assignment is to A, call the doctor's office, B, wait and see if you get a bill, C, use the physician tool finder at medicare.gov, or D, call Medicare. Well, this was a bit of a tricky one. I suppose you could do any of the above, but during our video, obviously, it was clear that I think that the best way to find out if a doctor accepts Medicare assignment is to go on the physician tool finder at medicare.gov. You know, calling the doctor's office, you never know who you're going to speak to and if they really know what you're talking about when you say Medicare assignment. You obviously don't want to wait and see if you get a bill because that's too late. And then calling Medicare, that might be something you could do, but then again, you're on the phone, you're waiting to speak to someone, and it's just not as quick as actually getting on the computer and looking it up yourself. So in this particular case, I would say C is probably your best bet. So how did you do on the quiz? I'd love to know in the comments section below. And if you like this video, press the like button, share it with your friends, and subscribe. And if you'd love to learn more about Medicare and how to make it less confusing, sign up for my free Medicare e-course at www.remedigap.com, where you will receive 1 email a day going over all the different parts of Medicare and Medicare Supplement insurance. Thanks again for watching, and I'll see you next time. Just shorten it. All right, I know to start all the way over. While I'm working.
When are you gonna leave?
Oh my gosh. Part A. Oh, no. And no, that's not what I want to say. Oh, and subscribe. I'd like go on and on and on. Just cut it out. Subscribe to my e-channel. E-channel? To that. No. Oh my gosh. Hi. Plan N. It's such a hard thing to say. Okay, that's good enough.